Hot start PCR. Hot start PCR is a technique that reduces non-specific amplification during the initial setup stages of the PCR. Hot start PCR technique may be performed manually by heating the reaction components up to melting temperature. So this is actually a manual technique which is used to minimize the non-specific amplification during a PCR reaction, and it is performed manually by heating the reaction components up to the melting temperature. Before adding, how it is performed? Before adding the DNA polymerase, specialized enzyme system has been developed that inhibit the polymerase activity at ambient temperatures. So these specialized enzyme systems, they have been used. When these specialized systems have been used, they inhibit the polymerase activity at the normal temperature or at the low temperatures. This is done either by binding an antibody or by the presence of a covalently bound inhibitors that only dissociate after a high temperature activation step. So before performing the reaction, an antibody which is usually bound to the DNA polymerase or by the presence of covalently bound inhibitors, they bound to the DNA polymerase and they will not allow to start a replication of the DNA. That can only possible when there is a high temperature activation step, and the high temperature activation step is the first step of the polymerase chain reaction, that is the denaturation of the DNA, that can be at 93, 94 or 95 degrees centigrade. So in case of hot start PCR, DNA polymerase which are most commonly used, they are U-bacterial type 1 DNA polymerase, which is called as PFU, and these thermophilic DNA polymerases are small activity at the room temperature. When there is a increase in the temperature that can be up to 95 degrees centigrade, then the reaction starts and DNA polymerase starts its activity. So this type of the PCR reaction is called as hot start PCR.